Everybody, welcome back to another video. In today's video, I'm going to talk about how I passed my NCLEX in 75 questions, and I did it under 1 hour and 45 minutes. Let's get started. If you're looking to improve your nursing skills or to gain more knowledge about the nursing profession, I highly recommend you subscribe down below. I upload a video every single week and you don't want to miss out. Alright, so I'm going to start off by saying that I'm not smart by any means. I just simply put my head down and work hard. And that means that you can do it too. You can pass the NCLEX in 75 questions and you can do it in a timely manner in 1 hour and 30 minutes, something like that. So what do I recommend you doing? Well, the first thing I recommend you doing is purchasing a tool called uworld. Now, a lot of people online have said that uworld is a great tool and they've used it a lot, and that has led to them passing the NCLEX, which is true. The reason why the uworld is so good is because it allows you to understand the format of the NCLEX. It shows you the questions in the exact NCLEX style, and also it allows you to time yourself while doing the NCLEX. So for that reason, I think the NCLEX, for that reason, I think uworld is a great tool for you to become more familiar with the NCLEX style and how it tests and how it's going to work on test day. Before I begin the video, I want to give a shout out to my friend RN Scrub, who gifted me one of these stethoscopes. So you definitely want to check him out. He uploads video about nursing and product reviews and all sorts of things, and you don't want to miss out on any of his videos. I'll link his video down below, his YouTube channel down below, and you want to check those out. Thanks guys, and let's get on with the video. So now I'm going to talk about specific strategies that you can utilize using uworld that has enabled me to pass the NCLEX in 75 questions. So the first thing I want you guys to do is to truly understand what the nurse's role is in the healthcare environment, in the healthcare team. Think about the nursing process, nursing diagnosis, implementation, interventions, and utilize those processes in answering each question. Think about what your role is. Don't think about what the physician's supposed to do. Don't think about what the physio's supposed to do. Think about what we do to the patient and what we need to be providing for the patient. So for example, a nurse's role in a hospital setting is to identify major abnormalities in a patient's condition and notifying the provider and providing effective treatment very fast. So you're going to want to know what are common diseases, like for example, when someone's in shock, and what you need to do effectively and quickly as a nurse to save that person's life. Think about it, guys. If you're in a clinical setting and a patient all of a sudden has a drop in blood pressure, what do you want to do? You want to give them a bolus of fluid, whatever the case may be. You want to give them IV antibiotics, bolus of fluid, or whatever. And they're going to ask you that on the NCLEX. They're going to expect you to know that for many different types of patient scenarios. So for example, mental health patients, for example, maternity patients, pediatrics patients, adult geriatric patients, and oncology patients. All the major abnormalities that you may need to know, you need to study those, and you'll see those in the clinical setting as well as on the NCLEX. So identifying the nurse's role in the healthcare team puts you in the right mentality when they've asked you a certain question, and that's really important for the NCLEX. Another strategy that I think is really important is for you to identify certain trends of questions. So there's certain diseases that I'm going to be talking about in later videos where the NCLEX emphasizes because it's so common and because it's so deadly. So for you to be able to identify this very quickly, it's important for saving that person's life. That's what we're essentially there for. We're essentially there monitoring the patient, making sure that nothing happens, and being able to provide effective interventions in a timely manner. So there's certain disease processes, which I'll make in later videos, that you definitely want to check out, that the NCLEX emphasizes because it's so common and because it's so crucial and deadly for you to know what to do. So another important strategy for a person writing the NCLEX to utilize is to identify their area of weakness. So every person working in any environment is going to be exposed to one certain demographic. For example, for me, I was exposed to critical care and med-surg type like patients. So I was personally weak in maternity and pediatrics, and these types of patients were disease processes that I was not very familiar with. So what I did was I specifically focused on that area of weakness during my studying. So I would focus studying the maternity and pediatric disease processes a little bit more. And each person that writes the NCLEX needs to do that, because if you think about how the NCLEX tests you, it tests you on basically your weaknesses. It gives you more questions on areas that you get wrong. And if you have a knowledge deficit in maternity and pediatrics, obviously it's going to test you more on that. So you want to make sure that you have no weaknesses. And if you do, you learn more about that certain disease process or certain patient demographics, so that you're able to answer all the questions that they may have to ask you. Alright, so the next thing I'm going to talk about is the fact that the NCLEX uses common sense. Well, what do I mean by that? Well, think about it. The NCLEX is an exam that tests you on everything about nursing, but that's pretty much impossible for someone to remember. You can't remember everything that the NCLEX may test you on. So what are they really testing you on? They know that you can't remember everything. So what you got to do is to identify how to think like a nurse. This goes back to my nursing mentality strategy that I talked about. You want to build a basis of how to critically think as a nurse. And that's what it's testing you as. That's what it's testing you about. It's testing your ability to critically think in different situations. So if you're able to develop that common sense and critically think like a nurse in different situations, then you're able to answer all the NCLEX questions. And the best way for you to gain that common sense is to do questions, which is another reason why I think uworld is so great, is because it allows you to practice that level of common sense. You're able to gain that level of critical thinking that you need to answer each and every question, but more so, it allows you to critically think in the clinical environment as well, which is the whole purpose of us being nurses and us writing this. And I can tell you with certainty that if you develop that common sense that I'm talking about, and you utilize the process of elimination for answering a question, you can definitely remove one of the 4 options that it has for you, just by simply having that critical thinking. Right, so the last strategy that I utilized for passing my NCLEX in under 1 hour and 45 minutes is to improve my comprehension. And the way I would do that is I would start a uworld exam with 75 questions, but instead of answering each question, what I would do is I would simply just read the question and write 1 sentence about what that question is asking me. So I would provide the most short form that I could provide for that question in summary form. So I'd write 1-point form with the least amount of words I could possibly do for 75 questions. And I would do this 2 or 3 times, and that improved my comprehension ability, and I was able to answer each question very quickly, because the next time I did the exam, the 75 questions, I was able to read the question, identify what it's asking me, and answer the question very, very quickly. So if you're struggling to keep time, or you're taking very long time to answer each question, I highly recommend that you improve your comprehension by utilizing that strategy. So since this video is getting a bit long, I'm going to be uploading different videos on strategies that you want to use for passing the NCLEX in 75 questions. Now, these are strategies that I haven't personally seen anybody talk about on the internet, and they're strategies that will for sure help you when you don't know what certain diseases are and you want to know how to gain more information about certain questions and how to answer questions in general more effectively. So you don't want to miss out. Please be sure to subscribe, and I'll see you guys in the next video. Thanks for watching.